Now, as the virus seems to be calming in much of Europe and accelerating in South America, Africa hasn't seen the explosion of COVID-19 cases that many had feared, although there are rising concerns that millions on the continent aren't accessing the healthcare services they otherwise would as a result of limited resources being funneled into fighting the pandemic. Well, for more on this, we can speak now with Robert Mihigo, the WHO's Deputy Incident Manager for COVID-19. He's also the organisation's lead for immunisation for the Africa region. Thank you very much for speaking to us here on France 24. Now, Africa hasn't seen as many COVID-19 deaths or cases as many had feared. Why exactly is this?
Thank you. My name is Richard Mihigo. Thank you for your invitation this morning. It's true that the tendency that we are seeing in many countries is contradicting the prediction that was done by many modeling data predicting a catastrophe in Africa. But we need to recognize that many countries on the continent took the right measure at the beginning of the outbreak. Africa was hit the last continent after the others, had time to prepare quite carefully on this, took the right decision at the beginning of the outbreak where there was very, very few cases to close the border, to close the traffic, and to put the main cities in lockdown. And we believe that these different measures have at least slowed down the transmission and is the result of what we are currently seeing.
Now, a lot of countries have been pushing testing and tracing as key tools in the fight against the virus. Are African countries putting that same emphasis on testing?
Absolutely. We have seen the last couple of weeks, many countries ramping up their testing strategy, doing a random survey in communities, in big cities. And the good news is that many countries have not seen the much increased number of cases despite the increased number of tests that has been done. So far, we have close to 2.5 million tests that has been performed in the region. This is increasing on a daily basis, and it has helped a lot of countries to direct their strategy on isolating cases, tracking those who are contact to the cases, and putting in place the right measure. But we need absolutely to be careful. This doesn't mean that the outbreak is not spreading. We are seeing countries, unfortunately, in the western part of Africa, southern part of Africa, that has seen an exponential increase of number of cases. So currently the advice from WHO is a word of caution. Countries need absolutely to make sure that all the cluster of cases are identified and the contact of cases are traced so that we can at least avoid a wide transmission of the virus.
Now, there has been a lot of renewed debate about the use of malaria drugs in particular in the treatment of COVID-19. A lot of African countries are prescribing the likes of hydroxychloroquine for those who fall ill. Now, the jury is out as to whether or not that actually helps. So why is this drug in particular so popular in African countries?
As you know, Africa is a region that is prevalent, where malaria is prevalent. So in the past, the chloroquine or hydroxychloroquine was a treatment that was widely used in many countries before the resistance to that malaria drug erupted. So when there was at least some indication that it could help a bit, so most of countries jumped on that avenue and tried to use the drugs. But as you know, we have been quite very consistent in this avenue with WHO, trying to put a word of caution on this and making sure that whenever the drug is used in a very well controlled environment in a hospital or in the clinical trial environment.
Now, we have just learnt that Gavi, the International Vaccine Alliance, has secured almost €8 billion for vaccination projects across the world, including in Africa, of course. Just how badly have vaccinations against the likes of polio and typhoid been affected during this coronavirus pandemic?
This was indeed a very, very good news for Africa, that the Gavi replenishment went quite very well. Beyond the 8.8 billion that was able to be secured, what is more important was that funding was also secure for the advanced market commitment from coronavirus vaccine that was launched yesterday by the president of Rwanda and other many head of state. But with regard to the traditional vaccine being, as you mentioned, called measles, polio, but other vaccine-preventable diseases, we have unfortunately seen a slow uptake of immunization in many countries due to the current COVID-19 situation. We have one country of potential outbreak of vaccine-preventable diseases we have seen in the past, like during the Ebola outbreak in West Africa, that measles outbreak increased dramatically during that. So this is what we are fearing to see again in many parts of the continent. And countries are doing their best. We are with the support of Gavi, WHO, UNICEF, to revitalize immunization and to make sure that children, the most vulnerable population, can again access the life-saving vaccines that they need.
Richard Mihigo, apologies for getting your name wrong earlier, and thank you so very much for speaking to us here on France 24. Richard Mihigo, the WHO's Deputy Incident Manager for COVID-19 there.